Welcome to Finding Certainty with your host and U.S. Army veteran, Patrick Laing. Over the next hour, you'll learn from Patrick and his expert guests how to attract more certainty into your business and your life. Now, here is your host, Patrick Laing.
Welcome to Finding Certainty. It's our favorite day of the week. We did this show on Fridays for a long time, and we looked forward to it all week long to end the week right, but we decided a couple months back to switch it over to Wednesdays. I guess you could call it now our hump day, where we have gotten our week off to a start, we're picking up momentum, and then we want a little bit of certainty in our lives to help us finish out the week strong. Really enjoying this new relationship with W-2 Studios, Bold Brave TV, our new network partner. Really looking forward to this next year in partnership with this extraordinary organization. But very impressed with the engineering crew, the management team, marketing, et cetera, et cetera. And we have some fantastic guests coming up, one of whom you're going to meet today. Every week, except for the first Wednesday of each month, I have different guests come on where we break down the various elements and approaches and aspects of finding more certainty in our lives. Rob Hagen, who's our guest today, is with Capstone. He's with a program that's helping provide additional benefits for companies. He's helping show them ways where they can help improve their recruiting, their retention, improve the satisfaction level of their employees and the performance level, and do so without any out-of-pocket costs. So Rob's actually one of those guests I've had on my show multiple times. That doesn't happen very often. I could count on one hand the number of guests that I've had back for a second episode. Rob, you've been on with me. What has it been now, Rob? 3 or 4 times, I think.
4 times.
That's right. So, I guess when something's working, you don't want to mess with it, right?
Amen.
Well, I appreciate your time. I know how busy you are, but what you're doing is so important. We wanted to get the message out, especially with the new partnership here with Bold Brave TV. Make sure people know what's available to them, what's happening, and really how the industry is shifting in a very real sense. So I always start out every show sharing 2 reasons why I've specifically asked this guest to be with us. First and foremost, Rob has spent his entire career helping organizations to be more profitable, to be more efficient, to do business right. Rob is a CFO by trade, a CPA. He's done over 130 mergers and acquisitions in his career, multiple IPOs. He's been all over the world helping companies to rise to the next level and to be as profitable and as efficient as they can, to enjoy as much certainty as they can. Right, Rob?
100%.
Yeah. The second reason, though, is, as I was alluding to before, is what he's doing today. And the program he has really helped develop, and he is spearheading now, that's blessing companies all over America. And we're going to get into what it is exactly and how it works. But Rob, again, thanks for being with me this morning.
Thank you.
For the 4th time. Is this the 5th time or the 4th time?
I remember 4.
I think this might be number 5, at least, especially with, we did one kind of a joint venture with another partner, but I think this is number 5, lucky number 5. So fantastic. Welcome.
Thank you.
So I wanted to ask you this question just as we start out. As you look back on your career as a CFO, as all of these mergers and acquisitions that you've been through, over 130, I mean, that's incredible, right? Most experts, even in your space, if they've been through one, it's a big deal, let alone 2 or 3, let alone 10 times that many, 100. I mean, I think about that all the time, Rob, when I think about you, and think, as you look back on your career, what lessons did you learn? But more importantly, perhaps, or equally important, the companies that did it right, what stood out about them? Right? What were their distinguishing characteristics, if you will?
Yeah, it's a great question. Haven't been asked that in a couple of years, so it's a good place to start. The number one success factor is if leadership comes in and they recognize that M&A is all about the people, and you can do all the financial due diligence, you can do all the operational due diligence and sort of see how the businesses are going to fit structurally and financially. Everyone's always talking about the synergy savings and all the rest, and that's important. But it comes second or third to the people. It's all about the people and making sure that the remaining team is going to work really well together, because if they won't, it doesn't matter what all the financial tools. I mean, I've developed more of the most complex financial tools of figuring out what the right purchase price is and how much money can be saved by putting these businesses together and what it's going to look like into the future. But if the team isn't built right from the ground up, doesn't matter. Doesn't matter. That is the driving force of what works versus what doesn't work. I've made mistakes. I've learned from those mistakes. Certainly still work with a lot of people, a lot of companies that are looking to do or are doing M&A work. And it's all about the people. It's all about the people.
Isn't that really the case in anything we do? Doesn't matter what the venture is. It could be a merger and acquisition, an M&A deal, or it could just be a startup, right? It could be a partnership. It could be a marriage. It's all about the people and their integrity and their transparency and their effort and their commitment, and the list goes on, right?
100%. And one of the things you learn in marriage, I mean, because as soon as you said that, I said it applies to marriage too, right? And what's different is companies are like people in that you go through cycles of maturity, right? When you talk to a psychiatrist or a psychologist, and when you first you're 18 to 25, and it's all about she's good looking or he's good looking, right? And if you look at Hollywood, the best looking people in the world, nobody lasts or very few do. So that can't be all there is to marriage or all there is. There's a lot of very attractive companies. That doesn't necessarily mean it's a great, and you go through a growth stage and a maturation stage, and eventually in marriage a retirement stage, and the adaptability of the people, the adaptability of the individuals that are involved in the marriage of a company or the marriage of two people is absolutely indicative of not just will it produce the results in the next 6 months, but this is going to be a part of your business forever, and is it going to last through through time.
I couldn't agree more. I have phenomenal partners myself.
You do.
You know, Victoria, Brian, Andy, and so forth. A lot of it comes down to, I think, not just choosing the right people, and that's not always easy to do, right? We enter partnerships that we thought were going to be good, and
Right.
and they don't go the way we thought they would. But regardless, I think so much of it comes down to a couple of things in my experience. Number one is that they are committed to doing what's right, taking the high road, right? Whether that's
Yep.
questions of integrity or commitment or under promising, over performing, et cetera, et cetera. But having partners that is always first and foremost to take the high road, to do the right thing in the right
Yep.
time at the right time. And secondly is just the commitment to keep at it, right? Because to not give up. I mean, it's business is hard. There's growing pains. We all make mistakes. We fall on our faces at times. We have to recalculate. Sometimes we have to back up a little bit and take the turn we missed, or whatever the case might be, right? But I think those two characteristics of integrity and consistency are really the key. And that's one of the things I've always loved about you, Rob, because you exude those two principles, those two characteristics. I've seen it in multiple businesses over the years. I've seen you consistently demonstrate those two principles. And that means a lot to us as your business partners, and I just think it's core, to making any venture work. So
it is, and it's true in business, and you and I have talked about this. It comes from the Bible as well, which is life is not about you. Life is not about the individual. You have to understand, in business, you do whatever's best for the business, which starts with do what's right for your clients and for your employees. And if you do that as a leader, and you show that with all your actions and not your words don't matter. No one's paying attention to your words. What they're paying attention to is what do you do on a day-to-day basis? And if you care for and love on your employees and you stay completely customer focused, you do what's best, even when it means you're going to lose money. In the end, things just work out, and you get a 10x on your return, but it's not short term. You've got to stay long term focused with your clients, meeting their needs, and things just work out. Clients want you to be successful too.
Well, I totally agree with you. I've seen it repeatedly throughout my career. When we started Certainty Management, we said the sales team is the heart of our business. We're a sales organization, a brokerage, if you will. And so we put them first. We created a compensation plan that was unparalleled. The kind of plan that I always wanted to have as a salesperson over the last 40 years, right?
Yep.
And so to your point, I think when you put your clients first, put your employees first, it doesn't mean that you're not a priority, you're not important, but you put those two groups ahead of your own desires and needs, you will always be taken care of. It's like when you pay it forward, it comes back to you tenfold, right?
It does.
When you're, and it's actually a really good lead into Capstone and what you're doing through the Corporate Benefits Initiative.
Yep.
We are up against we're going to take a quick break. We're visiting with Rob Hagen. He is a good friend of mine, also a consummate business professional, and spearheading a project here, an initiative that is changing lives all over the country. It's an extraordinary just add-on and value add for any organization out there who has at least 10 W-2 employees. And that's basically the minimum requirement, 10 W-2 employees with earning at least $25,000 a year. And there's a lot of those out there, we know, on up to any size, right? So we're going to go to break real quick. We'll be back with Rob here in just a minute, and we'll continue the conversation, dig into what it is, how does it work, and how can you benefit from it as a listener, maybe your employer, your business, and we'll answer a few questions and go from there. So don't go away. I'm Patrick Laing with Finding Certainty. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk on the BBM Global Network.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
You're back with Patrick Laing here on Finding Certainty, and my special guest today, Mr. Rob Hagen. I like to say VIP because Rob is not only a good friend, but he is an outstanding business leader. I have a few people in my life who I consider mentors and professional friends that I really look up to. Rob, you're one of those, and I don't want to make your head too big, but I do appreciate you very much. And I'm excited about all the business that we have in the pipeline that we're doing together. We're helping thousands and thousands and thousands of employees, and it's exciting because not only from a business standpoint, obviously we want to be successful as an organization, but really it's more about the impact that we can have on these employees and their families' lives. And so, before we get into how we're doing that, let's go back a little bit and talk about what brought us to where we are today. And just to be clear, if you're listening, the program that Rob is referring to is a program. It's a health and wellness program. It helps employers provide an additional suite of services, about 15 or so services, health and wellness benefits, with no out-of-pocket cost to the employer or the employee. Okay, these programs like this are founded in a tax code that's been around for almost 80 years, since 1948, called Section 125. And essentially, and correct me if I'm wrong, Rob, this is the way I usually explain it, but Congress has said we're willing to take less taxes today in hopes of spending billions less later on Medicare, right? If we can, we'll take less taxes today as long as you'll put it into health and wellness for your employees. Help them get more healthy. Let's try to hedge and head off the chronic disease. It's so expensive when it happens, right? And so this program is founded in this tax code, Section 125. It's the same tax code many cafeteria plans and other things are based in. IRS says you can pay less taxes. We're going to help you can take less state, federal, less FICA tax, as long as you put it into these types of benefits. Now, a lot has happened in the last 77 years. Maybe you can talk, Rob, a little bit about how it's evolved and how it's progressed to where it is today, and why so many companies are looking at this. Why it's turning so many heads.
Yeah. So what I would start out with is, I started looking at these plans probably 5, 6, 7 years ago, and had a ton of companies that were, dying for tax savings, additional benefits, and all the rest. And I'm a CPA by nature. That's my style. I'm not going to talk about it at a cocktail party, but I'll absolutely go take a deep dive and make sure it's right. And what I would say to you is, or what I would say to everybody was, the plans didn't hold up. The plans didn't hold up. And there were a number of IRS memos that showed why they did not hold up. They did not strictly follow the tax code in terms of what you needed to do. And they did not deliver the results the IRS is expecting. If they're going to put the money towards these kinds of programs, they expect to see identifiable, measurable results that the employees are healthier, more productive, and they're ultimately getting to that age of Medicare and Medicaid healthier, that we are making an impact on the health of Americans through the employers. And what I would say is, in the last 2 to 2.5 years, these programs have hit the mark. I've gone from a -10 out of 10. I wasn't even a 0 when I first started thinking about coming back into this business. I was a negative 10. And I came in and I took a look and took a deep dive and really found out the how do the financial flows, how do the information flows go, and what's the impact that they're having on the employee. And it is night and day. It is delivering tremendous results. They've gamified it. They've made it fun to be healthy. It's very measurable, and there's just a lot of neat things in the marketplace now that make it a real program that the government is supporting.
So, Rob, what were the biggest issues with previous plans and previous iterations? I know what we have today and how it's evolved is 100% compliant. It's simple, it's straightforward, it's powerful. But maybe we can go back and maybe just talk a little bit about what the biggest hurdles were. What were the biggest problems that these previous plans had
Yeah.
that have now been eliminated, right, or improved upon?
Yeah. So promoters were overly focused on the cash savings, the fact that these plans make the business more profitable, and not on the health and wellness of their employees. That was critical error. First and foremost, these plans have to be about delivering measurable results for the health and wellness of the employees. Secondly, there's specific tax code sections that allow the employee paycheck to be kept whole so that there's no out-of-pocket cost. There's very specific requirements in terms of the billing codes and the real benefit that's being given back and the out-of-pocket cost that's being reimbursed. It's gone from, well, this sounds about right, to being very trackable and traceable and provable through what the third-party administrator in these plans are now doing. So it's back in a good place. These plans are clearly compliant, and they're delivering the results that we all needed from the first place. And that just wasn't the fact. And part of it is technology. Part of it is getting through COVID and realizing what was possible with technology that doesn't have you sitting in a doctor's office or an emergency room. And then ultimately getting to a place where the benefits are less expensive than the tax savings, which was hard to do and required tremendous scale in the program.
Right. Well, I know as a business owner, I mean, we have over 100 associates across the country and clients in all 50 states. Every business out there is looking for ways to add more value, right? To help with recruiting, to help with retention, employee satisfaction, production, as I say. They're all looking for that, right? And if there's a way to do it without going to added expense, it's kind of like the holy grail, right? It's exactly what they're looking for, because so many employees, when they come to an employer, this first question they have, what are the benefits?
Right.
And if you as an employer can add an additional 15, even if you already have a major medical health plan, but these 15 additional plus or minus benefits that layer on top and fill in the gaps, and we'll get into what those are here in a minute, but that's a big draw. It's a big recruiting draw. It's great for retention. An employee isn't going to leave and go across the street to make another $1 an hour and give up all these benefits that they have, one of which is a guaranteed issue life insurance policy, right? Up to $100,000. I mean, that's a big deal. And I know as an employer, I know how important that is. And but you've got to make sure that you're giving your employees something that's truly going to work, and it's truly a value add, not just in name, but actually in delivery, right?
100%. Yeah,
So,
there's no question. Go ahead.
We talk to employers every day, and those are the questions they're asking. Those are the needs they're seeking to fill.
That's right.
And to your point, there are programs out there that claim to do it. They claim to have a deliverable. They claim to be able to provide it, but they haven't gone through the steps to be as compliant as they could. They don't have an insurance program, for example, that will protect them if they ever were audited, right, by the IRS. This program you have has a plan that will cover them, goes back 3 years, and guarantees that if that ever did happen, which is unlikely, but if it did, it would cover them, right? And so you're checking off all these boxes, Rob, with your program, and they're the questions employers have, right? Is it going to be
100%.
valuable? Is it really going to work? How am I protected? What if the IRS decides to be difficult, right? Those are the questions employers have. They're questions we had, and the fact that you're addressing them kind of preliminarily, right? You're heading them off. I think it says a lot.
Yeah, I think that's 100% right. And employers, I'm amazed, but it just makes sense. They really care about their employees. Their issue is they live within a budget. It has to be affordable. And the win-win here is that you can get your cake and eat it too with this kind of a program, and that everything that employees and their families are needing. Let's be clear, group health insurance is very reactive by nature. You get hurt, you get sick, you go see a doctor, you get fixed, or you get a medication and you get healthy again. There's for how much we spend in health insurance and taking care of ourselves, our health is terrible as a country. We don't finish high in the list of countries out there. And so what's missing is when you're in your 20s and in your 30s and in your 40s, do you have access to the resources or the ability to understand what is my holistic health, not just your medical health, but your financial health, your mental health, and everything that was defined as health and wellness by the ACA or Obamacare. They were very careful about how they thought about wellness of individuals, regardless of age. This plan addresses 100% of those needs and does so in an easy to use, easy to access. You can do everything from your own home in a minute or two. Or if you want to take an exercise class, you want to get access to a nutritionist, you want to do pet care, you want to make sure that you don't have to go spend $1,000 in your local veterinarian for emergency pet care. If your pet eats a cactus, they can help you deal with some of these issues from home in the most cost-effective way. All again at no cost, no copay, and no limits in terms of the number of times you use. Unlimited wellness benefits for everyone in the family.
See, I love that word wellness, right? We're talking health and wellness. It's so much more comprehensive, to your point, than just medical. If I need stitches, I'll get stitches. If I need surgery or something, my medical plan is going to kick in those cases. But I want to be healthy. I want to be well. I want to feel better and have the energy and the longevity that so much, I think all of us do, right?
Right.
And that's what these plans are founded in. That's why, like I said before, Congress has said, hey, we'll take less taxes if it contributes to wellness.
Right. Because they know find the ROI in the data. Right.
Yeah, they know the long-term payoff effect is going to save them billions. It's actually, I joke with my clients that it's an example of Congress having foresight, which unfortunately doesn't happen as often as we wish it did, right? But as you look across the country and the different clients you're talking to, what are the biggest concerns they have that this is helping to address, just from the feedback that you're receiving?
Yeah, so the first comment I get 4 or 5 times a day is, this sounds too good to be true. And you really have to understand, when you hear Elon Musk or the president or Congress talk about wellness, and they ultimately talk about the productivity, the driving of GDP. You always want to see GDP growing as a country. They tend to focus on today technology and AI. Those are the two things you hear over and over and over again. And that is that's absolutely part of the solution. What people don't get is that you can have all the AI and technology in the world, but if your employees aren't coming to work happy, healthy, ready to go, it doesn't matter what technology you put into play. If they're having a child that's dealing with suicidal thoughts, or you've got a spouse that's that it isn't getting along well with you, and you don't have the resources to be able to do couples counseling or drug and alcohol addiction counseling, or you've got a sick pet, you are not coming to work fully productive. And everything that you can be dealing with from a wellness perspective, you've got the resources and help to get all of those things solved so that when you come to work, yes, AI and technology have a huge play in helping employees be more productive year after year. But if they're not healthy, mentally, physically, financially, and family-wise, it doesn't matter what you give them to work with. And they want to understand, how does that work? Because I've been focusing all my time on how do I deploy AI tools and other technology tools to improve productivity. But you're telling me that if I make this investment, and it's really an investment in time, not in money, to give them access to all this stuff, my productivity is going to improve, and I can show them facts. I can show them results in terms of, yes, and this is how it's going to happen.
Well, and a program is only as good as its adoption, right?
Right.
And so we have all of these benefits available, unlimited telemedicine and counseling and free prescriptions, and these benefits that make up this program. I mean, just having a large life insurance policy there to protect your family provides a great deal of peace of mind. And then you add the other elements with no copays, right? That's what I love about it. But
No
these things,
copays, no cost to use, and never limits in terms of the number of times you use the benefits.
I know it's incredible, but when you implement these things and you start seeing your company, the workforce production levels rise, there's ripple effects, right?
Sure.
I mean, I know exactly what you're talking about. 'Cause my wife deals with some health issues, some chronic health issues, and when she doesn't feel good, the best she can do is to just get out of bed and maybe take a shower, right? I mean, because she deals with chronic fatigue and some things like that. And so, I know if you are not feeling well, or you're stressing about something, or even like you said, even if your pet is sick, it affects everything else. It might affect whether you even show up to work, let alone if you're productive when you get there.
100%.
And those costs of lack of productivity are billions and billions of dollars a year here in America, let alone helping our employees be healthy for the future and reducing Medicare costs. Just the current costs of productivity and illness.
It gets worse with age.
Yeah, it just exacerbates.
It does.
And so we're up against our second and last break. We'll be right back. We're visiting with Rob Hagen about his capstone program. This is good. It's good, kind of peeling back the layers of the artichoke, as I say, on why this is needed, why it's so important, how it's working. We'll get into a little bit more of the benefits when we come back, and how companies are taking part in it, why they're taking part in it. So don't go away. You're here on Finding Certainty with Patrick and Rob. Come on back. We'll continue the conversation in a minute.
Great.
Dr. RC will share extraordinary resources and services that promote educational success, as well as making a difference in the lives of all social workers, as well as the lives of children, adolescents, and teens of today. She will have open discussions addressing many of the issues that we face about our youth, and how being employed in the uniquely skilled profession of social work for over 18 years has taught invaluable lessons through her personal experiences. She will also provide real-life facts, examples, and personal stories that will confirm that why serving as a child advocate is extremely beneficial when addressing the needs of the whole child. Listen live to Dare to Soar, Saturdays, 10 a.m. Eastern on the BBM Global Network, and TuneIn Radio, as Dr. RC will provide thought-provoking information that will empower, encourage, and strengthen students, families, and communities across our nation. You can also visit her at soarwithkatie.com. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Listen to John Hawkins' My Strategy, Saturdays, 1 p.m. Eastern on the BBM Global Network and TuneIn Radio.
Welcome back to Finding Certainty. I'm Patrick Laing, your host, with Rob Hagen from the Capstone program, what we call the Corporate Benefits Initiative. CBI is a program that is blessing more and more lives all over America. It's turning a lot of heads because employers like myself and like you, Rob, we're looking for ways to help in our efforts, right? Help us with recruiting, help us with retention. We want our employees to be productive and happy, and if they're not feeling well, if they're worried about a relationship, they need some counseling. Maybe their pet is sick. Maybe they have a medical bill that's hanging over their heads. They could use help with getting that reduced or erased. All of these things add up to make us less productive. And that's what we want. I think that's what we want as employers, but that's what most employees want. They want to be productive. They want to come to work and enjoy what they're doing and feel like they did an honest day's work and were able to hit their goals. And so, one of the things about your program that really jumps out to me and that we've really appreciated is how easy it is for them to use. You talked earlier about gamifying it and so forth. Maybe you can talk about the biometric app and how the delivery of these benefits are provided to the employees. Because I think, to my point earlier, adoption is key. If you may have the best program in the world, but if nobody uses it, it's no good, right? And so let's talk about that delivery if we can.
Yeah, and you mentioned, just if the program isn't good, it's a Section 125 plan, so it's voluntary. And voluntary means they can opt in or opt out. Our opt-in rate on Capstone is 96%. That's almost 100%. You won't find 96% approval rate on anything. That's what this has. So it's pretty good. It comes with a full biometric app. What does the biometric app mean? It means you literally take facial and body scans in the privacy of your own home with no one else around. Takes about 10 to 12 seconds. And within 1 minute, you're going to get things like blood pressure, your pulse rate, your temperature, 15 different vital signs. Don't have to, but anytime you want to, whether it's an emergency or you're just checking to see how you're doing, it's going to do it. It's also going to have a full dashboard. They're going to score your health based on your age and any pre-existing conditions. They're going to score your health anywhere from a 1, which probably means it's time to tell your family that today may be the last day, or up to 100, which means you're infallible. Go skydiving. You're good. Never seen that, but anyway, you're going to get a health score, and then they've gamified the whole system, which makes it fun to be healthy. So if you could put, again, this is all driven by the employer and what they want to do. If you want to improve your health score by 10% and you get a 70, so you want to improve your health score to a 77, your notices, everything on your dashboard, everything in your email is going to come across and say, hey, these are the things you need to do if you want to improve your health score by a 7. And if you do, we'll give you 50 points, 75 points. Those points are redeemable into gift cards. You get gift cards to your favorite restaurants, to Amazon, anything you want to do. There's 650 different gift cards, and it makes it really fun to be healthy because it's all HIPAA protected. You can't compete against your other coworkers unless you want to do a private and you want to share that stuff with somebody. Typically, you see the competitions with the family and all the rest, but it's gamified. We found that the usage of the app has skyrocketed, and the health of the individual as being measured against the what's available is probably 3x what it used to be a year or two ago.
Well, and I know for myself, I'll work harder to win a fishing trip than I will for a paycheck or for anything else. So being able to gamify it like that and make it competitive, even just competing against myself and my own goals, that's very attractive. And
It is.
it's really cool. I know there's a lot of stories along this line, but because the employees are engaging in it, because they're doing their selfies for the health, these biometric scans, it gives them all this data point, and because it can be uploaded to their primary care physicians automatically, it's actually
Yeah.
saved lives, right? I heard one of the stories about a very successful, very busy, I believe she was a COO.
Yep.
And
Yeah, we had it was a woman.
yeah, tell that story.
She was a chief operating officer of a good sized company, 800 employees. That's a good sized company. And she felt great. She absolutely felt great, but she was, using the app, 3, 4, 5 times a month. It takes a minute to take her vital signs. And she got a call from the doctor and just said, "Hey, we were reviewing your vital signs, and we have noticed a 37-point increase in your blood pressure. And we would strongly recommend that you go see a cardiologist as soon as possible. We don't know that anything is wrong, but we think that it's worth going and taken a look at it." So she went immediately. She went to the hospital, had them run some tests. The doctors said, "This is awesome. We can actually see your vital signs over the last 8 months and see what's happened. What we can tell you from what we're seeing is it looks like a blockage. We're going to run you through some tests." Literally 12, 15 minutes after they ran the tests, they came back in and said, "We found a blockage. You're probably at risk of having a heart attack in the next 4 to 6 weeks. We would like to recommend that we put a stent in and do surgery immediately." She agreed. She checked into the hospital, went through the surgery, and they just said, "Look, we don't understand what that app did, but it may have saved your life, but it certainly saved the value of the healthiness of the rest of your life, the quality of the rest of your life." And that's what this program is all about. Because once you've had heart disease, once you've had a heart attack, the costs and the inconvenience and the lack of productivity that you as a human being can have just changes dramatically. You just aren't the same person anymore. And I'm sure I've certainly seen it in my own family, and I'm sure you've seen it in yours. But that's what this program is all about, is to catch things early so that you don't have the complications with things that can absolutely be avoided with the right preventative treatment, as well as the best group health insurance. Again, this does not replace group health insurance. You still want that group health insurance so that you can go into the hospital and have the heart surgery to save your life.
100%. Making health easier and engaging and even gamifying it so it's even more motivating, the paybacks of that, the rewards of that are almost inestimable, right? We hear other stories where a lady was having stomach issues and it was bothering her, and she was just going to go to sleep and try to sleep it off. She took some aspirin, but her husband said, let's call telemedicine. There's no copay. There's no barrier to entry, right? So they called, talked to a physician. He asked her a few questions, had her press here and there, and he said, "You need to get to the hospital immediately. In fact, keep me on the phone." He stayed on the phone with them when the ambulance showed up. He stayed on all the way to the hospital, and it turned out she had a blockage, an intestinal blockage. My own mother dealt with that last year. It's life-threatening. They said if she had gone to sleep, she probably wouldn't have woken up. And so making our health and our wellness, there's that word again, our wellness, easier, affordable, no copays, engaging, and I think that the payoff and the rewards of that are almost incalculable. We've got about 5 minutes left here, Rob. What else would you add that we haven't touched on?
Well, so let's be clear. So these plans are voluntary. So if you as an employer bring these to your employees, everyone gets to make their own decision of whether this is right for them and their family. But again, there will never be any out-of-pocket cost for them. The life insurance policy is a second decision. One of the things the IRS requires is that if anything that's a part of a Section 125 plan, which the Capstone plan is, it can contain a life insurance policy, but it cannot have a death benefit of greater than $50,000 to keep the plan qualified as being Section 125 qualified. Our policy is it's not a term life insurance policy, it's a whole life insurance policy with a death benefit of up to $100,000. And because it's such a big, rich policy, all available, again, paid for with tax savings, it has to be a second plan. So every employee gets to say, hey, look, after the plan is paid for with my tax savings, I've got about $100 left over. Do I want that $100? That's my money. I can take that home as additional take-home pay, or I can make a decision to invest that money in life insurance. And this is a whole life insurance policy, so it's got a death benefit, or it's got a growing cash value over time, which belongs to the employee and forms an additional retirement benefit for every one of your employees. It's really second to none. And it's Mass Mutual. They've been around for 180 years, second largest life insurance company in the world, bigger balance sheet than FedEx. I mean, this is a big, big, big company with lots of assets under management. Great company to work for, great company to work with. And like I said, everything's available over the app. Once you've got the app installed on your phone, on your laptop, on your computer, you've got 24/7. If you've got Wi-Fi or cell phone access, you've got access to all the doctors, all the mental health practitioners, all the benefits we've talked about, prescriptions, over 1,100 prescriptions available at 85,000 pharmacies, anytime, day or night, mail order at no cost for the most commonly prescribed goods. We've got a diabetes care team that also comes with significantly discounted prescriptions for all the diabetic DRE, the DME, the durable medical equipment that comes for the diabetics. It's really endless, the number of things that you can bring to you and your family. Your spouse is covered. Your children under the age of 26 is covered. And it comes with a hospital indemnity plan that'll provide you cash. Your group medical plan may have a $200 deductible on going to the emergency room. That's all going to be paid for and more by your hospital indemnity plan. All right. So there's so many reasons to do this for your employees. I can't come with any bad reasons or reasons why you shouldn't do it. It's easy to implement. It's easy to manage. It takes a couple minutes a month as an employer to manage this program, and your employees are getting so much, and you're going to get additional profitability on top of everything else we talked about. Really, really good.
Well, we're huge fans, Rob. We've been working with you now for a long time. I love the no copay piece. I love the life insurance piece. I mean, if an employee leaves, they lose those benefits. They can take the life policy with them. It is the one thing that's portable, but they need to start paying for it, right, out of pocket. And so being able to offer these benefits to your employees with zero out-of-pocket cost, such a great blessing to them. So, Rob, we appreciate you being on Finding Certainty again. I appreciate your friendship, and always a pleasure to reconnect and catch up. And this thing just keeps getting better and better. And so thanks for listening today. If you're out there, we appreciate you being a part of our family, part of our Finding Certainty family, and now our Bold Brave TV family, as we continue to spread this message of certainty across the country and around the world. So thank you for being with us. Have a great rest of the week. Certainty is out there. You can find it. We can help. We wish you the best. If you'd like to learn more, go to certaintyteam.com or call us at 888-684-3122. We wish you the very best, guys. Take care.
Thanks for tuning into today's episode of Finding Certainty. We hope you've gained some more insight into how to create more certainty in your own business or nonprofit. Join us next week for another taste of the certainty experience. Until then, we wish you greater certainty in all that you do.